takes pleasure in attracting a stellar list of speakers that address today's most relevant issues. The club's place as a refuge for rich discussion and networking has never wavered after 123 seasons.
We are dedicated to encouraging debate on the issues that matter to this city, this province, and this country.
The Canadian Club is one of the most important podiums anywhere in the world that a Canadian can speak to, tell Canadians what it is that they think, develop those thoughts. And so I want to thank you for that very, very much.
Please join me in thanking our esteemed panelists today.
Through our programs and events, including our youth and young leaders programs, our diversity partnerships, our joint events, and our media and social media opportunities, we offer you access to dynamic political, social, and business figures from abroad and right here at home.
The platform from which the eloquence of Canada has flowed all of that time, whether it be business, education, politics, sports, arts, and culture. If someone wants to say something to Canadians about this country and about the future of this country, this is the venue you choose.
Hello, and thank you for joining us. My name is Anita McCuitt, and I'm the president of Canadian Club of Toronto and national leader TMT and consumer markets for PwC Canada. Since the beginning of the pandemic, Canada's community pharmacies and pharmacists have been on the front line of care, continuing to provide access to health, wellness, and home essentials. Today, we're joined by Jeff Leger, president of Shoppers Drug Mart, for a candid discussion on how pharmacies have stayed focused on patient care, prescription therapies, new digital services, all while embracing urgent challenges like COVID-19 testing. Before we dive into today's topic, here's some information about how to participate with us. If you find that your internet is slow, try the click here to switch stream button. The video quality may decrease, but the audio should stay strong. If you have questions today, and we do want your questions, just click the questions tab, type it in, and it will go directly to our moderator. The Canadian Club is a nonprofit, and we've been gathering people together for over 124 years. And it's because of our sponsors that we can continue to do that. So thank you to sponsors, Carney, the Ontario Pharmacists Association, and PwC. We're grateful for your support of today's discussion. Now to introduce today's speaker. Jeff Leger has been president of Shoppers Drug Mart since January 2018, having previously held the role of executive vice president, pharmacy and healthcare. Jeff is a licensed pharmacist and has worked throughout the hospital and generic pharmaceutical manufacturing sectors. During his tenure, Jeff has led Shoppers' vision of becoming Canada's leader in consumer health and wellness. Mr. Leger will be joined in conversation by David Simmonds, 2020 Visiting Fellow for the School of Advanced Studies at Western University and Canadian Club President-elect. One of the club's traditions that has not changed in this virtual world is the toast that we make to our country. If you have a drink nearby, please join me, make a nod to the screen, and make a toast to Canada. To Canada. David, I will turn the Canadian Club podium over to you.
Thanks so much, Anita. And Jeff, thanks so much for being here. It's a real pleasure to see you, albeit virtually. Normally we'd be in person somewhere downtown chatting, but it's good to see you and welcome to the Canadian Club.
Thanks, David. My pleasure to be here. Really look forward to the discussion with you.
Great. Well, Jeff, there's questions coming in already online. So I think people are really excited to chat with you about Shoppers and about how things are going. I do think, though, it's important sometimes to take a step back and sort of reflect on where we are and how things are happening. And I was sharing with someone earlier, this time last year, I was in the US at a work meeting and, got a phone call that we may need to come back. There's something happening called the coronavirus. And, I know for those people that don't know, I used to work in an adjacent business to Shoppers, and we started to think about how we could service and support our customers in healthcare. But you were running a pharmacy. What was that like a year later? How did you rally people and how did you approach this back last year?
Yeah, it's been a really crazy year in many respects. And before I kind of touch on some of those points, I want to take this opportunity to thank all of our frontline colleagues. They've been with us all through it. Lots of change in regulation, lots of change in consumer behavior, and really they really were there to help focus on keeping our customers safe and also our colleagues safe. So many people know that we run a franchise system. Our Shoppers Drug Mart stores, we have pharmacist owners, they're called associates. And during this whole pandemic, we spent weekly calls, daily calls as things were kind of changing. And I think hats off to them for their leadership with their teams. Through it all, they were able to really focus in and support their communities. And I think what's really interesting, we can go through many kind of crazy changes in terms of consumer behavior. We had early in the pandemic, some crazy buying around toilet paper and a whole bunch of runs on stockpiling things that really wreaked havoc on our customer experience. And we had to fall in together, really kind of work hard with our suppliers and our partners, who I know some of them are on the call today, and a big thank you to them for their support. But I think at the center of it was really focusing on what was really important to our communities. Shoppers is in almost every community across the country. 85% of Canadians live within 10 kilometers of one of our stores. And over the last couple of decades, many Canadians have come to rely on our pharmacies and pharmacy in general for health and wellness advice. And this was really true as we were going through the pandemic. If I use an example of what happened around pharmacy, we had lots of runs on certain medications. There was worries about shortages. There was also a big change in terms of healthcare access. You think about overnight, lots of physician offices that weren't geared up and ready for this type of pandemic. Not that everybody was, but they kind of went dark for a period of time. And I'm incredibly proud about how our pharmacists, the frontline colleagues, were there to help support community, fill that gap in, provide access to care from trusted professionals that they know. And I think we've done a really great service to Canada on that front. I'm incredibly proud. Yeah. Just one little example, David, because it's not only about pharmacy. Obviously, we're a large beauty player. We're also a pretty formidable food player now, being part of the Loblaw family. And I have we've had great customer stories from across the country, but there's one I think that really kind of articulates our values and also our purpose as a company, helping Canadians live life well. There's a story from Victoria where I got an email from a customer that was sharing with me that they were elderly, and also had some chronic conditions and were housebound and isolated. And I think that's a pretty common story that's been well told during one of the unintended consequences of this pandemic. And she didn't have any money, so called down to her local store. I think it was an assistant manager that answered the phone, and the customer was saying, "Could you just send me a loaf of bread?" And she says, "Well, we're not just going to send you a loaf of bread. What else do you need?" And they actually sent her a whole basket of food. And she sent an incredibly powerful email to me. And I think that's just a nice articulation of how important Shoppers Drug Mart is and the level at which our colleagues go to really remain focused on the best for the customer.
I think that's just such an amazing story, Jeff, and it does put a highlight on leading from a place of values. And the pandemic, if it's done nothing, it's reminded us that we're human. We ought to be caring about each other and caring with each other. People may not know who are watching. Jeff's a pharmacist himself, so he knows what it's like to be in that space, in addition to now running Shoppers Drug Mart. OPA is a sponsor of today's session. And I think, Jeff's thanked pharmacists, but we should probably just thank all of our pharmacists on the front line across the ecosystem, as we often call it in pharmacy, and those who support them from production right to dispensing. So a big thank you to you, Jeff, for thanking our colleagues on the front line. Testing. We're hearing so much about testing. I think that Health Canada, or the FDA, just approved at-home COVID testing. I've been tested for COVID. I know a number of Canadians have been tested for COVID. As an operator of community pharmacy, close to Canadians. What's your thought on testing? And I know pharmacy played a role in that in Alberta. You guys were a leader there. Talk to me a little bit about your journey and what's happening on the ground.
Yeah, listen, that's a great question. I think all of us want to get back to some type of normal. We want our loved ones to be safe. We don't want to get COVID, but we also want our economy to restart. And I think there's three things that are incredibly important for that to happen. The first is we need to follow public health recommendations, masks, social distancing. Although the longer this goes, the harder it is. The second one is extensive testing. And I'll come back to that in a second. And the third one is really about a fast and efficient rollout of vaccine. So on the testing front, we've been in ongoing dialogue with many provincial governments and also federal governments to really highlight the value of using pharmacy as a channel. Obviously, our stores are open late. Obviously, pharmacists are well qualified to do this type of activity. And it's just so convenient, the proximity to the population, confidence and trust in those professionals. So our journey has been working with provinces such as Ontario and Alberta. We started really in Alberta, where we played a role in doing asymptomatic testing. And that started out with the opportunity to help in the summer and then leading into September when the schools were restarting, testing teachers, testing students, and testing against the different criteria that they had there. And I think it was a very effective tool to be able to do it conveniently as opposed to going to an assessment center, and also took asymptomatic testing out of the symptomatic testing centers. In Ontario, we've done the same thing in the sense of we have about 138 stores, and there's many more other pharmacies that are doing it too. So David, you spoke about the broader population and broader community of pharmacy, and I think everybody's been doing a great job on that front. So this is the same element of looking at asymptomatic testing, and these are all PCR in the first phase. Now, the interesting thing is there's an ability to move into antigen testing or the point of care testing. And I think that's a real game changer, especially with the number of tests that are available by the federal government. So we're testing it today in Ontario with a couple of scenarios through the Creative Destructive Lab, the consortium. And we think that we could do more. So we're waiting from provinces to say how they would like to do it. I understand they may want to do it in terms of schools returning in Ontario. And I think pharmacies are just so well placed to do it. And I think we can make a big difference in terms of testing as many people as we can.
For sure. I think the scale required probably needs us to rally the resources that we have. When I think about testing, to your point, and you mentioned immunization, I'm reflective. Yesterday I was watching the news and President Biden's announced that there's a plan for our pharmacy colleagues in the US to be a part of their immunization strategy. What are you hearing? What are you seeing about potential action in that space in Canada, whether it's from the provinces or the feds? And should I be able to get my shot at a pharmacy? Is pharmacy the right place for me to get an immunization of this kind?
The short answer is absolutely. It is the most convenient and the most efficient place to do it. Now, the longer story is we've been having dialogue with the federal government and the provincial governments over the past couple of months. I would say that they've been extremely productive over the past couple of weeks. And I think they see the value of tapping into 11,000 pharmacies across the country as an ability to ramp up the vaccination at scale. And if we think about using 11,000 pharmacies across the country to do this, we're probably talking about 3 million, maybe a bit more than 3 million a week. So as vaccine becomes available at that level and that scale, you can really turn on all pharmacies in Canada. And we know that based on our experience in flu and flu vaccination in the past fall. Lots of people didn't want to have the twindemic. So there was a real run on flu vaccination in the fall. And in our network, in our Shoppers Drug Mart stores and also the Loblaw pharmacies, we saw over 2.1 million flu shots in a span of 5 weeks. At the height, we probably did 500. I'm sure that the only constraint on us was the flu vaccine availability. We could have done close to 1 million. So those numbers are real. And I think that's really caught the attention of the government. they've been really focused on the first phase, and I think that's right. Like, I think props should go out for the governments. It's a very tough job to be able to manage this through a pandemic, to be able to get it right in the first phase, make sure you get frontline healthcare workers in hospitals, make sure you get long-term care facilities covered. So I think they've done a good job on that front. They're now focusing on phase 2 and phase 3. Phase 2 is other frontline workers, age groups, and then phase 3 is the broad vaccination. And I'd say that many provinces will use pharmacy as that channel. And I know that our pharmacists are ready to do it. And I think the broader pharmacy community is ready to stand in there and do what needs to be done to get this country back on order.
That's incredible numbers, 2.1 million. That sounds almost like a seasonal number, not something you do in 5 weeks. So it's clear that there's a lot of effort and focus in that. I remember, again, Jeff and I know each other a long time and collaborated on a number of things. And I remember, I won't say who the health minister was, but I remember one of the health ministers in Canada told us there was a lot of nervousness around giving pharmacy access to flu, but it was the smartest thing they ever did in the portfolio, because it did expand access and make it more available. So hopefully health ministers are watching this and hear this, and we can move quickly in that direction. I'm sitting at home, you're sitting at home. I don't think any of us thought we'd be here for a year. I feel like my day is a bit slower than it used to be, but there is one space I think of life that's gotten really, really fast. If COVID has made virtual just a necessity, right? We're doing this event virtually, where normally we'd be together in person at a hotel somewhere. Talk to me about the influence of virtual on Shoppers Drug Mart, whether that's care or beauty or food. Has it accelerated your business and your practice, or is it sort of run of the mill, or what's happening in the store?
Yeah, so let me start with beauty, because we are Canada's largest beauty player, although that area has been challenged during COVID and work from home. We saw a real big increase in terms of our e-commerce, and we've been on this journey to be really a truly omni-channel beauty player. We have great beauty advisors in store. We have great locations, beautiful brands, and I think just a really great experience. But we knew we needed to have a much more enriched experience on e-commerce and also in social media. And that took off in a real meaningful way during the pandemic. So we were happy to see that. Obviously, that is part of our strategy, is to marry the two, and we saw that accelerate. So I think that's been a great thing. On the health side, we tested a whole bunch of different initiatives during the height of COVID. We had an offering with Maple, offering primary care for free through virtual care for about 3 weeks to all Canadians, and more than 20,000 Canadians took advantage of that when it was at the height where a lot of physician offices were closed. So I think it filled in a gap, along with the work that our pharmacists were doing and filling that gap in stores. And then we also tested a whole bunch of different digital health products around mental health with Silver Cloud. There's a whole bunch of areas where we tested and learned. And I think what I would say around digital health is I think we've advanced by 2 or 3 years during this pandemic. I think people liked the experience and thought it was useful for many of the reasons they were trying to consult a healthcare practitioner. So I think that is a sustainable change. I think that's going to be there. And for us, that's an important part of our strategy. We see healthcare in the future as really being omni-channel, digital, with lots of tools that are convenient and right for the use, and then in-person experience, which is either in pharmacy or also in health clinics. And we did launch a health clinic with primary care physicians right in the middle of COVID. So, our plan around healthcare and certainly around digital is that two-prong approach. And we think that we can really create a front door to healthcare. And we think that's very exciting. And I think Canadians are ready for that type of experience too.
Yeah, questions are, it's almost like you're the Prime Minister. The questions are just rolling in, and I'm through them. So if you see my eyes darting, that's what I'm looking at. There's a question here that I think is interesting. Danielle Martin is a friend of the club and a friend of mine, and she's been an advocate for virtual care in the hospitality setting for quite some time. And she's talked about how that's changed the practice for physicians in that space. There's a pharmacist, I'm assuming, asking us, how do you tie the acceleration? These are my words, not the pharmacist. Tie the acceleration around healthcare to accelerating pharmacy scope of practice, right? So I know you've been an advocate for greater scope for a number of years. Is there an opportunity for pharmacist scope of practice advocacy because of virtual, the way we're seeing it on the physician side, do you think?
Yeah, so there have been services that have been provided in some jurisdictions virtually for pharmacists. So I think that there is some momentum there. On the greater question about expanded scope of practice, I think that we're going to see an acceleration over the next year. I know in Ontario, we're in the process of seeing minor ailment changes coming and scope going to pharmacists, which I think makes a lot of sense. And I see a lot more of this happening in the future. There's, I think, a receptivity with the provinces. I think we, as a profession, stepped up during this pandemic and filled in gaps when our physician colleagues were having some transition challenges going from the physical to the digital, and then eventually they did. And I think it's important. One of the things that we don't talk about a lot, obviously we spend all our time talking about the pandemic and getting out of it. There's been some really devastating unintended consequences of this. We're not getting to see as many people diagnosed on chronic illness, diabetes, heart disease. We've seen that in the data that we have. We also see people not seeing as many acute issues. That's a positive because we're not seeing as much cold virus going around and flu. But I think that there's underlying health issues that pharmacists, if they had additional scope, could help not only screen, but also start initiate therapy, obviously within the context of working with the broader healthcare system. So I'm excited about that. I'm worried about what's gone on in terms of some people delaying diagnosis, and there's been many articles written about that, about how we've seen some unintended consequences around how other healthcare needs falling behind COVID.
It's interesting you say that. Anita mentioned I'm a visiting professor at the moment. I teach communications, but I used to work at McKesson, which is a large supplier of medicines and products, and I love my colleagues there. So I still get the reports, not from McKesson, but the IMS sort of industry data. One of the things I noticed in IMS's recent report is that prescription and acute prescriptions are going down, or we've seen a decline on year-over-year trend, right? So, you've talked about the implications of that data, right, and what that means in the market. What can pharmacists do to help patients, knowing that that's a reality, knowing that, or the assumption we can make from that data is that there are probably things going on seen and unnoticed. Should we be going into pharmacy? Can pharmacists help us? What do Canadians need to hear about that as we manage isolation and distance from other healthcare practitioners?
So yes, absolutely. Pharmacists are well suited to be able to help identify people that are maybe not, that don't know they have diabetes in terms of screening them, or don't know they have heart disease. Most pharmacies have blood pressure machines. And I know that in our network, that's one of the most used data points in terms of being able to help people. So I think Canadians absolutely can. And we actually have seen that during COVID. As I said earlier, for acute needs, ran out of medication, don't have access to physician. And I'll actually share another interesting story. This comes from Newfoundland. And it was just in the middle of COVID. There's a customer that came into the store, was looking for something for heartburn, asked and spoke to the pharmacist. The pharmacist realized that the person was having a cardiac event and actually sent them to the hospital. And the person was very reluctant to go because they weren't from Newfoundland. They were there coming out of quarantine. And the pharmacist insisted, had the person go to the hospital. 3 days later, the customer came back with 6 prescriptions. They had a cardiac event, had a stent put in, and came in to thank the pharmacist to say that if they wouldn't have pushed and insisted, the outcome could have been much worse. So our pharmacists are well placed to be these frontline healthcare providers, not just for vaccination and prevention and filling prescriptions and giving advice, but actually screening for, I think, really serious health concerns that may not have, in some this case, it had an immediate impact. In some cases, it has a long-term impact to the healthcare costs. And I think I'm excited about it. As an organization, we're very excited about it and are putting a lot of effort around making sure our pharmacists have what they need to be able to do that, and are excited about the opportunity. And I know the broader pharmacy profession is too.
No, that's great. That's great to hear. And I know in my lived experience, pharmacists have been true partners in healthcare for parents and children and myself. So that's great. I'm getting a lot of questions about the other side of your business. So we've talked a little bit about the dispensary and the healthcare side. People are really interested to know what they can expect to see in the front store, and what innovations do you have that you can talk about with us around front shop, beauty, convenience, and food.
Yeah, it's an exciting front shop business. Like I'm incredibly proud of the work that our stores do in terms of the store experience, but also the teams at our central office in terms of the work they've done around getting really great brands and really being thoughtful about what does the customer journey look like? What are they really looking like? Are they coming in for a convenience item? Are they coming in to explore new and innovative beauty products or skincare? So I think what you're going to see from us is more around beauty. And I shared the fact that we obviously leaned into e-commerce during the pandemic. We are leaning into social media. We're leveraging a lot of our local beauty advisors that have great talent in social media to really reach out. That is an important channel, especially around inspiration around beauty. We have great partners on brands. We sell some really incredible luxurious brands and prestige brands, which I know our customers love. You're going to continue to see some innovation on that front, and more doors with more great brands. On the center of store, we have a big focus on food. We've seen that during the pandemic, we were seeing double-digit growth on food. Obviously, we were seeing big lineups at different grocery stores, and people discovered that we've been selling food for years and decades. We've just recently, since the acquisition with Loblaws in 2014, been selling a lot more fresh. So eat now, eat later, meats, vegetables, and other offerings. And that has been incredibly well received by our customers. And I would say during the pandemic, that really shot up, and people saw it as just an easy way to get in and get out, and actually provide solutions for them for meals. So we're going to continue to roll out more fresh. We like that. And then you're just going to continue to see in the center of our store, just to focus on new. We like to have the newest product. We like to have all the products that you need, but we also like to entice you in with some innovation. So there's a lot happening on that on that side of it. I'm really excited about our front shop business. It's incredible.
That's so great. I haven't heard the eat now, eat later phrase, and I'm going to use that one. I'm going to call it a eat now, eat later, eat all the time. I like to eat, so that's great. That's really great. PC Health. And getting questions about the PC Health app. Someone here is excited to have seen it launch. What's your vision, and how can it be a part of the day-to-day lives of Canadians in managing their health is the question.
Yeah, so just go back to that concept of omni-channel healthcare experience. We see a really important role for digital, and obviously we see an incredibly important role for our pharmacies and other healthcare groups that we have, like our medical clinics. What was important for us was to bring together in the digital space something is like a digital front door to healthcare. So PC Health is an app where you can go and get access to care. You can text or chat with a nurse or a care navigator. And the result of that could be you need to go see a primary care physician, or you need to go see a pharmacist because they have the scope to do that. Or it's a problem or an issue that you can deal with through a digital program. So that's the whole concept, is to create that digital front door to healthcare, allow people some options in terms of accessing care, making it easier. We have a great healthcare system in Canada. Sometimes it's hard to access, or it's hard to understand where to go and navigate. I think this is our attempt to try to do that, and it's off to a great start. We're very pleased with it. It's obviously wrapped in with PC Optimum too, which is an incredibly powerful loyalty program in Canada. And we know that when you think about helping people adopt healthy behavior, this is a nice tool to be able to help incent people to go that extra mile or go that extra step to kind of help themselves along their health journey. So we're excited. It just launched in the fall in Atlantic Canada. Being from New Brunswick was important for me that it started there. And then we started to roll it out across the country. And I think it's going to be something really important for us.
It sounds like there's enthusiasm around it. So that's really awesome. Jeff, you mentioned your medical clinics, and then there's a question here of how do you see primary healthcare clinics continuing to grow? What role are they going to play at Shoppers? And how does it link with your commitment to pharmacy is, I think, the question.
Yeah, I think not many people know this, but we have about 600 medical clinics that are on our different properties across the country. And our view was that we would try a concept around managed care, around creating an environment that's a little bit more cohesive, a little bit more digital focused. So that was our first launch of the clinic at Dufferin and Lawrence here in Toronto. It's called the Health Clinic by Shoppers. And we have a couple more pilots happening in the city this starting in the first and second quarter. And we'll test and learn and see how that goes. Our view is that it connects in with this healthcare ecosystem. So we want to be able to provide some solutions where people can have easy access to healthcare in the sense that their PC health information could move through to their clinic if they choose, all obviously at the patient or customer's privacy request. And I see it being very complementary to our role as pharmacy provider and providing primary care in the pharmacy too, and retooling that pharmacy. We're trying to move away from more of the dispensing activities and more focused on care delivery. Obviously, there's a role for pharmacists to play in that space, but there's always a role for physicians to play too, in terms of the care and the acuity or the complexity of the cases that need to kind of require a different healthcare professional. So we see them complementary. We are obviously very focused on the pharmacy component of it, and our testing and learning with the health clinics.
That's awesome. That's really awesome. Jeff, it's interesting I'm on a Google Doc, right? So the questions are sort of popping up, and then I'm reading them. We didn't ask you if you wanted to talk about this, but I have you on live, the equivalent of live television. So I'm just going to ask and see what happens. There's questions here about leadership. You're leading a large team, a national team, and there's two questions that I think are interesting around leadership. What message would you give as a leader to your teams today as they continue to navigate the pandemic? And then the follow-up, I'll give you some time to think about it, is what message has a leader given you that you've been either gotten inspiration from or held on to as you've navigated probably the most unprecedented year in a long time?
Yeah, that's a great question. I'm lucky to be surrounded with a lot of great leaders centrally at Loblaws and obviously at Shoppers Drug Mart with my team, but also with our stores. Like, we have these associate owners in every location that lead their team, which can be about 50 people. And I think the message that that certainly has been consistent all the way through is we're going to get through this as a team. We're going to work to find the best possible solutions. We're going to care about our customers. We're going to make sure that they're safe, and we're going to do right by them. And then the same thing is true for our employees and our colleagues on doing right by them. And it's been really a challenging environment, but I think it's also been a pretty exciting time. Like, there's obviously, this pandemic has been horrendous in many regards. It's allowed us to go through initiatives quicker. It's allowed us to get alignment quicker, and I would say that our teams are very much aligned on the model that we just talked about around care delivery and about going faster. Like, how do we move away from that dispensary model? How do we move into care? So I spent a lot of time talking about where we needed to go and why we needed to do this, because you want to be able to disrupt yourself as opposed to being disrupted by somebody else. So it's a combination of factors, David. I think there's no grandiose statements. It's like we have a great strategy. We do the work every day. We care about our colleagues. We care about our customers, and we challenge ourselves. And a lot of it's alignment, really kind of understanding the opportunity in front of you. I've learned those concepts from many different leaders across the time, including leaders that I work with today and for today, are very inspiring, but all very practical, great vision, but all very much focused on building it day by day and just being humble, getting the work done and building on something that's incredible. We have an incredible brand, one of the most trusted brands in Canada with Shoppers Drug Mart. So it's indeed an enormous privilege to lead this company.
That's great. And I think that that resonates with me. So it will probably resonate with a lot of people watching. One of the questions that we're getting is around the core practice of pharmacy. So as we're growing and Canadians expect more from their pharmacists because pharmacists are responding, right? Whether it's a small community or an urban community, they're responding. How have you navigated supporting the core practice of pharmacy in addition to some of these growth areas, both as the president of Shoppers and then also across the Loblaw network? Like what's been some important bets or choices you've made to make sure that the heart of the practice is supported?
Yeah, I think the biggest thing has been, how do we lean into technology? How do we work with our pharmacy system to make it as efficient as possible? How do we lean into e-refills, digital pharmacy type tools to reduce the technical work at the stores to make it really easy for them? And there's a slew of things that we did during that period of time, including how we managed inventory to help them make it really easy to focus on the patient or the customer. We're also heavily focused on centralizing dispensing activities around automation, because we really believe that the future of pharmacy is really in that primary care role. Like, it's really, where do you have a health system where you can go anytime from 8 to midnight or overnight and access somebody that can really give it without making an appointment and access that care? So our role is to free them up, give them good tools, and work through those tools with their advice, and then look at trying to reduce some technical activity so that they can really focus on the profession.
I think that's really important. And efficiency that is helpful and not necessarily disruptive is probably needed and timely.
Absolutely.
What's going to be your biggest takeaway after the pandemic, do you think? I don't even know when it's going to end, so I don't even. hopefully there's some time-bound nature to it.
There's a lot of takeaways. I think one that's really clear to me is that we can do almost anything we put our minds to. Like, if we have good alignment, we collaborate, and that is true across our pharmacy sector. It's true within our business. It's true with our associate owners. It's true with our provincial health partners, that we really can focus in on important things, and we can do them quickly. And there's many other things that have been really great that I've learned. Stamina is a really interesting one. This has gone on a long time, so I think all of us have kind of developed a new degree of stamina. But I would say that really the biggest one is our ability to move quickly and to really move at the speed also of customers' needs and really filling in those gaps and roles.
If there was a product or service that I should go try at Shoppers Drug Mart, I'll give you two. What would they be? Two recommendations from the president's choice. Two products or services that I should be looking at trying.
Well, I think I'll give you a couple. So on the digital front, I would really encourage you to download PC Health. and engage with that, with what we believe is the future of healthcare navigation and that front door to healthcare. I think that's important. I would encourage you to interact with our beauty online and also the in-store experience. We have amazing beauty advisors that have great recommendations around skincare, around many great products that we have, and I think that's exciting. And I would think there's two other ones. I think the pharmacy services that we're providing in terms of screening are extremely important, and they're well done. They're easy, accessible, and I'd encourage people to do that. And then finally, just going into food, because we're part of a large food organization, is discover us as a food player. We have some really great offerings. We're close to Canadians, and I think you'll be very pleased with it.
The blue menu, it's great. I can tell you it's delicious. And beauty is important. I don't know if you guys can notice, but there's a ring light in my glasses. I got a ring light here because I think that showing up it matters, right? So I'll send you one, Jeff, so you have it.
I'm using the natural light of the sun, but yes, I think there's value in having a ring light. I haven't purchased one yet.
They're available. You can get them. Jeff, two more questions for you, and the audience is giving you compliments now, so you can feel good about that they really like you. You're likable, which is nice to know. Someone is asking about, which I think is interesting, they're pointing to the partnership you have with Maple, right? A Canadian startup, a great idea. It's almost a David and Goliath story, right? Someone who's got scale and reach, and then someone with a great idea. What do you envision as lessons that we should take from that, about how Canadian enterprise can partner with startups and scale-ups to drive transformation? Are there lessons that you've learned so far, or insights that you'd offer some of your colleagues?
Yeah, so we have two relationships where we have small investments through the family of companies. The other one is League, which is the platform behind PC Health, and we've I would say advice. Obviously reach out to us. We're very approachable, even though we feel like a big company, we don't act that way. We try to be nimble, we try to be agile. If you use the Maple example, we had been working with Brett and his team for quite some time. We really liked how they operated. And we were able to stand up that free offering in April quite quickly, like really at record times. So we can move quickly, and I think it was really important for us to lean into Canadian startups in both cases, with League and with Maple. And in our past, we've also we acquired an electronic medical records company called QHR out of Kelowna, BC, and that's also been an incredible piece to our overall digital health kind of offering. So we like to support Canadian. We're a Canadian company, obviously, and we like to support Canadian entrepreneurs where we can too.
That's great. That's good news for Canada, really. Last two questions. This one is from a pharmacy student. How do you see pharmacy education changing, or how should it change, given what we're going through with COVID-19?
So that's a great question. I think pharmacy education has changed quite significantly over the past couple of years. I think pharmacy students and new grads are becoming very qualified to practice, in some cases well ahead of the scope that exists in the province. I would see it's going to continue to evolve. I think we're going to see things like more around screening, more around helping manage conditions in a meaningful way. If you think about removing dispensing activities and really focusing in on patient care, I think the education is already there, but it will continue to evolve, and I think we'll continue to advance on that front. I think point of care testing is going to play a big role, obviously, in what scope and what else pharmacists are going to be able to do. I know there's some elements of that already within the pharmacy education, but I would lean into those elements, because I think with new technologies that are coming, a lot more will be able to be done in the community, whether it's in a family practice or also within a pharmacy, that will give us information that will allow us to better serve Canadians with their needs in a convenient way, which I think we all want. So I think it's really exciting as a pharmacy student to be graduating now. I think it's a really interesting time in the profession. It's been a few years for me, but I'm very encouraged with the future for pharmacy students.
That's awesome. Jeff, I'm listening to you and I'm really enjoying our conversation. Questions continue to come in, which is great. I have some takeaways. I just want to make sure I've captured some lessons. First one is wash your hands, wear your mask, follow public health guidelines, because we're going to get through this, so we're going to get through it together. I think the second thing I've heard is that where we need to really get a comprehensive testing strategy rolled out in Canada, and pharmacy can continue to play a role in that. And I think the third thing I heard, there's more than three, I'm going to give you a few. The third thing I heard is pharmacy can play a role in injection. You've proved that with flu shots, and you're ready to help shoppers and across the community of practice. And the fourth thing I heard is that you've got some really exciting things happening at Shoppers Drug Mart, whether it's PC Health, whether it's new items in the center store, whether it's innovating pharmacy practice in the back store. So we should continue to watch, visit, and get 2 times the points when we get those emails. Is that right? Are those good takeaways?
Those are definitely the takeaways. We're ready to partner with all governments to really get this country back going. Like, we need people to be safe. We want our economy to get going. And I'm incredibly excited about the innovation that we have across our whole business: beauty, food, center store, but pharmacy and healthcare are also really accelerating at a great rate, which I think is incredibly exciting for us.
Great. Jeff, if I put my communications hat on and think of your colleagues, I'm going to give you, this time of year, I miss you. I'm just going to say it. I miss you. I miss hanging out. This time of year, we'd probably be at a conference somewhere, right? We'd probably be in a hotel hallway, catching up on things. And then you'd probably go on stage and you'd say something. You'd give us a rallying cry as people in the profession. Give us that rallying cry that we need. Every pharmacist, associate, colleague, people in the market, distributors, what do we need to hear as we look to hopefully get to the finish line of this pandemic?
We're going to get through this. There's no doubt in my mind. We're going to come out of it, I think, with really some cool innovations around healthcare. And I think that's exciting. It's exciting for the country in terms of access to care. And I would just encourage everybody to lean into it. Like, really embrace this change. Like, let's take this pandemic as an ability to park some of our older thinking, park some of our older resistance to certain changes, and really embrace it. And I think we'll do great things for the country on that front.
Thanks so much, Jeff. Anita?
Thanks, David.
Back to you.
Thanks, David. And Jeff, thank you so much for joining us today. Pharmacies have always been an essential part of our healthcare system, but as we rethink how we provide primary care for Canadians, I think it's clear from your remarks today that pharmacies could have a much bigger role to play. And as we think about vaccinating some 30 million plus Canadians over the coming year, our pharmacy network is going to be essential. And I've just downloaded my PC Health app, so looking forward to exploring that later today as well. David, thanks again for guiding today's conversation. Guests, we hope that you'll join us for some of our upcoming events at the club. Join us next week on Tuesday, February 9th, when we'll host a panel of experts from Enthusiast Gaming, the NHL, and the Biden-Harris campaign to discuss how brands and politicians are leveraging the popularity of video games. They're also leveraging social media, digital comms to get their message out to Gen Z and millennials, which is an increasingly important and influential demographic. And on Wednesday, February 17th, we'll host a panel of trailblazing Black executives who are doing the work to nurture and amplify Black excellence and leadership in business. This expert panel, with leaders from Capital One, CIBC, Boyden, and the Canadian Olympic Committee, will highlight what's working, what we're missing, and how we can leverage immediate opportunities to make a more equitable today and tomorrow. Thank you again to Carney, the Ontario Pharmacists Association, and PwC for sponsoring today's event. Our events would not be possible without our sponsors, so thanks for your continued generosity. Thank you to our AV supplier, Van Valkenburg Communications and LiveMeeting.ca for making it possible to come together virtually today. Guests, thank you for joining us. Please stay healthy and stay safe.